Hello everyone, 大家好. Today we're going to talk about a very commonly seen skin condition, herpes simplex. Now let's go to the shared screen, the slide. Okay, herpes simplex, we call it herpes here, is a common viral disease. It is caused by herpes simplex virus. It causes blisters and sores around the mouth, nose, genitals, buttocks, conjunctiva, and the cornea, and they may occur almost anywhere on the skin. For chronically ill patients or people and the newborn babies, the viral infection can be serious, but rarely fatal. There are two types of herpes simplex virus, type 1 and type 2. As a Chinese medicine practitioner, I see herpes often. Even last week, I've seen one person. She has used steroid hormone for her autoimmune disease. And then she developed herpes. She came to me, want some herbs to get rid of it. And I've seen another patient for more than 2 years. She has herpes all over the place, all the time after chemo and the radiotherapy. And the herbs helped her a lot, helped her life quality a lot as well. I've seen 7-year-old girl was brought by the mother who has herpes on the lips, and then the mother is trying to ask me to help the girl to get rid of it. And also I have young, beautiful girls came to me with genital herpes, and she was frustrated because it's very, very difficult when she has new relationships. If she likes someone, she worried whether she should tell the person she has genital herpes or not. She doesn't want to end, a relationship. But if she doesn't tell the person, and the person in the future developed genital herpes, and the person can still be angry, and then can still be stop the relationship. And plus, he can pass to other people in future. So this is quite complicated issue. I keep on telling my student in the class, I say, just be cautious when you have sexual relationship. It's not something you can play with without any worry. There are a lot of things can happen. Genital herpes is something which happens, it doesn't go away. It causes you discomfort. That's one thing. Another thing is it can damage the relationship or make the relationship more complicated. But anyway, let's go on. As usual, I will very quickly, briefly introduce some general knowledge about herpes, and then we go to the Chinese medicine part. The type 1 herpes infection appear as tiny, clear, fluid-filled blisters that most often occur on face, we call cold sores, less frequently in genital area. There are two kinds of infections, primary and recurrent. Only 10% of those who are exposed to type 1 herpes virus will develop sores. The sore most commonly affect the lips, mouth, nose, chin, or cheeks, and occur shortly after exposure. For the type 2 herpes, usually result in sores on the buttocks, penis, vagina, 2 to 20 days after contact an infected person. Sexual intercourse is the most frequent way of getting the infection. Both primary and the repeat attacks can cause problem, including a minor rash or itching, painful sores, fever, aching muscles, and a burning sensation with urine. The lesion of both types of herpes can be spread by touching an affected part of the body immediately after touching a herpes lesion. There's no vaccine to prevent this contagious disease, but we can use some prevention method to stop it further spread or stop ourselves to get infected. With mouth herpes, one should avoid kissing, sharing cups, or lip balms. For persons with genital herpes, this means avoiding sexual relations, including oral genital contact during the period of symptom or active lesions. Condom can be used, but the condom cannot prevent the area around the genital area where the herpes to spread to other people. But at least condom can stop certain level of spreading. There are many photos in the website about herpes, different parts of body herpes. I'm not going to show you more. You can look at the website by yourself. Now we come to the Chinese medicine. We talk about the etiology and the pathogenesis first. Herpes in Chinese we call 热疮, heat sores. So obviously we think this heat related. We generally consider there's a damp heat combined with exterior toxin retained in the skin. It causes the herpes. The redness shows the heat, and the blisters exhibit dampness. Herpes that appear on the upper part of the body are due to wind, damp heat, and the toxin attacking and leading to fuming upwards in the lung and stomach channels or meridians. Acupuncture meridians is a major part of Chinese medicine. Often we explain our diseases with meridians involved. Lesions on the lower part of the body are often caused by damp heat and toxin lodged in the liver and gallbladder meridians. Recurrent herpes is usually a result of dysfunction of spleen stomach's transportation and the transformation, causing accumulation of damp heat, which then steams upward or may be due to heat injuring the fluid earlier and giving rise to insufficiency heat, which blazed upward into the tissue and the skin, then causing the herpes lesions with severe pain. Babies have low immunity resistance. The toxin can go to interior in blood and organ level. High fever, convulsion, seizure can happen. Together with whole body blisters, some can die or leave brain damage. Now, pattern identification and treatment. The first type is called a wind, damp heat, and toxin affecting upper body. The skin lesions are red at the beginning, and the patient feels tight and burning. Blisters appear later with clear liquid inside. They can be itchiness or itching and pain together. Patient can have fever, dry mouth, dry stool, yellow urine, red tongue with thin white or yellow coating, slippery and fast pulse. Our treatment principle is clear heat, dispel wind, detoxify, and eliminate dampness. We modify 辛夷清肺饮. 辛夷 is a herb. 清肺 means clear the lung. 饮 means decoction. The original 辛夷清肺饮 is used for damp heat caused bleeding nose. The dosage is pretty low. It's ancient formula. Now for herpes, we modified it. We increased the dosage and the ingredients are modified as this. I leave you to have a good look, and so far you should understand every herb's function. For the modification, if patient has local redness, very strong local redness, we can add 生地 牡丹皮. For many blisters, which show there's a lot of dampness and toxin, we add 麻齿苋 华石. For the strong dry mouth, it shows the heat is very severe. We add 银花 or called 金银花 连翘 麦冬. 金银花 and 连翘, they are antiviral herbs. 麦冬 is the herb can moisturize the mouth, nourish the yin. The second type is damp heat lodged in the lower burner. The skin lesions are often around the genital area. Patients can have blood-tinged urine, dry stools, or constipation. A red tongue with a sticky yellow coating and a very slippery and a rapid pulse. The treatment principle is resolve the dampness, clear heat, and detoxify. We modify 龙胆泻肝汤. This is very famous formula, mainly used for clear the liver heat. The ingredients are here. I'm not going to use the time to repeat them. The dosage can be reduced when crusting starts, and the 白术陈皮 can be added to tonify spleen and the stomach. As we said earlier, the blisters show there's a lot of dampness. Dampness is often related to the weak spleen and stomach. So we need to add 陈皮白术 to tonify and then to consolidate our result, and also to correct patients' weakness or deficiency. The next type is deficiency heat pattern. The herpes lesions are recurrent. Patient has dry mouth, dry lips, thirst with a desire to drink, a red tongue with no coating, and a thin, rapid pulse. The treatment principle is nourish in and clear heat. We use 知柏地黄丸 to modify. 知柏地黄丸 is a famous formula as well. I'm not going to repeat the ingredients here. And then you, as long as you remember, you use 知柏地黄丸 to modify. 知柏地黄丸 is from 六味地黄丸. 六味地黄丸 is a formula to nourish in, and then add 知母黄柏, focus on the lower jiao dampness. So this can be used for the herpes. Herpes, in both type, but due to the indeficiency. Now, talk about the external treatment. We can use few washes to wash the herpes area. 马齿苋 wash is a very simple. We just simple wash. We use 马齿苋decoct in 1.5 liters of water and down to the 300 mils and apply as a warm wet compress 3 times daily, 10 to 15 times each minutes each time, 10 to 15 minutes wash every time. 马齿苋herb you see everywhere in our park, but this season, sometimes you go to the park, you don't see any 马齿苋. Sometimes you see them everywhere. They can be eaten as a vegetable as well. If you don't have the raw herb 马齿苋, you can use granules. When you use granules, you don't have to decoct, which is much easier. You just use granules, make 300 mils of wash, and wash the lesion straight away. Another one is 玉露膏, jet dew ointment. The ingredients are 木芙蓉叶 powder plus petrolene jelly, 5 times of petrolene amount of petrolene jelly. 木芙蓉叶 is not very commonly used herb, so if you can get it, will be very good. If you can get a granule, will be really good. You can use it. 马齿苋 is much cheaper, much same. 四黄膏 is an ointment with 黄芩、黄连、黄白、大黄. How to make it? I've talked about it in my acne and eczema talk. So you can go there, have a look, or go to my reference. I'll show you just soon now. You can go to the reference to find out how to make 四黄 ointment. You can let patient make it and put in the fridge. So if patient recurrently have herpes, they can use it for the long term. Okay, now prevention. As we talked before, we treat primary outbreaks promptly and thoroughly to prevent recurrence. Avoid factors which include recurrence. For example, certain food, stress, and tiredness. People who have herpes, all know when they're tired, they're stressed, the herpes will flare up. So we avoid all these factors. The patient, they know by themselves to avoid these kind of factors. And then we try to reduce the recurrence. Okay, now the herpes simplex is finished. I'm going to talk about the herpes zoster in the next session. It's another commonly seen condition. Now the reference books are here. You can stop the video and have a look if you like. Now the talk is finished here. I hope you like it. Now, I'll see you in the next talk. Thank you for listening. Goodbye.